Dr. Kathy Gardner, I'm so sorry for the loss of your father. You believe it was connected to a patient being sent home from hospital, don't you?
Yes, I do. I know that when my father first became ill, I was told that a lady had been discharged back to the care home and she had tested positive for COVID-19 and she subsequently died of it.
So you feel it was seeded into the care home that your father was in and led to, I mean, your father unfortunately suffered and died. Were there other people in the care home who were infected as well?
Yes, I mean, my father was never tested. When he became ill, the GP said that they just couldn't test. When he died, obviously no samples were taken, so we don't know that he absolutely died of coronavirus. It's probable COVID-19 on his death certificate. The GP was excellent. I spoke to her and she explained that a number of patients in that care home had died of what she suspected to be COVID-19, but we'll never actually know. But you have to draw the connection, and I think it's appalling. The government approach to discharging patients from hospitals back to care homes was absolutely appalling.
Well, David Crabtree, you run 2 care homes in Yorkshire. We've now heard the Prime Minister say unequivocally that the care homes were advised to lock down before the public, before March the 23rd. And secondly, we've heard the Health Secretary, Matt Hancock, and Michael Gove both say a protective shield was put around care homes. What is your reaction to those statements?
Incredulous. On the 2nd of April, the government's advice was, if an individual has no COVID symptoms, then the care should be provided as normal. No PPE, no testing for asymptomatic discharges from hospital, and my care homes were infected by discharges from hospital of people who 3 days later after discharge developed signs and symptoms and consequently sadly died.
I mean, the first advisory that we can find from the government that people should be tested before they go back to care homes was April the 15th, which is 3 weeks after the national lockdown. And Boris Johnson claims the lockdown in care homes was before even that. This is just a lie, isn't it?
It's an absolute lie. Matt Hancock, on pre-election, came to visit my care home. He met with the lady who was 101, an ex-RAF driver during the war, and sadly she died of COVID in hospital only a couple of weeks ago. This is an absolute outrage. Who? All I want to know is who sat down in a meeting, basic cross-infection control, and decided, having watched Europe, that we should now discharge people into hospital with active COVID. I have a letter dated the 31st of March from the local CCGs saying that care homes should help create capacity in hospitals and allow COVID into care homes.
I mean, that lady that you talked about, she actually met Matt Hancock, did she?
Yes.
And what did he say to her?
Oh, I mean, on the day of the visit, he was very good. I like the chap. But what he's doing now is he's dug himself into a hole. And what the whole nation, this morning at 8 a.m, my care staff are going into a care home where 7 people died of COVID. And still today, the residents have not been tested.
You see, and all we hear from the government today, the government minister, Theresa Coffey, is on the airwaves, not ours. She won't come on this programme, but on other shows, saying that she takes great pride in what the government's done with testing, and that, yeah, you are a care home owner who's seen residents die in large numbers, and they haven't had tests for the workers, the residents, anyone.
They are expecting minimum wage people to go into work protected by a piece of plastic, and still we don't know who has COVID. We don't know how it spreads. We've had professors on this morning saying that it could be airborne. We're not sure how it transpires. But what we're saying is, who decided to do this? Where is the CQC and all this? The CQC, their remit is to protect patient safety, and yet they allow people to be discharged from hospital with COVID. I'm angry. I go to bed angry. I wake up angry. The very people who have cared for these dying COVID patients will now be furloughed because care homes have now dropped over 25% of their occupancy and are now unsustainable. Without immediate government intervention, care homes, the social care sector will collapse within 5 weeks.
Wow.
Yeah, I mean, and that would be devastating.
But this is
not least for the residents.
It's horrifying to hear this. And we know it's the truth. I've heard this from so many people that run care homes and work in care homes. You know, we just know that we're being lied to.
Dr. Kathy Gardner, nothing is going to bring your father back. And I'm sure, you know, you probably go to bed angry as well and wake up angry. What would you want to hear from the government? Would it make a difference to you if the government said, you know what, we made a mistake. We didn't anticipate that care homes would be as badly affected as they were, but we are doing everything in our power. And they did everything in their power to put that right now.
No, that wouldn't make me feel better at all. That answer simply isn't good enough, and it isn't going to stand up to interrogation. There should be a public inquiry. You've got to look back at the dates. On the 16th of March, the vulnerable are those over 70 with underlying conditions that may make them more vulnerable. The 16th of March, they were told to stay at home. On the 19th of March, the discharge guidance document was issued. It's entitled COVID-19 Discharge Service Requirements from HM Government and the NHS. 3 days after that, we all went into lockdown on the 23rd. So there is no excuse of we didn't know what would happen. That discharge document is very interesting. I've read it. What's conspicuous by its absence in that document is any consideration of what to do with people in hospital who've tested positive, who have symptoms or not of COVID-19. Nothing. There's one mention of testing, that maybe the test results should be put in the notes so the care home would know.
They were specifically told, in fact, they didn't need to test. They were specifically told in hospitals, you do not need to test people when you send them back to care homes. And that may well turn out to be criminal negligence. We have to leave it there. It's shocking. We're going to keep on this. Thank you, both of you, for coming on and telling us the truth about what has been happening. If people need to hear this. When they hear these lies from these ministers and from our own Prime Minister about what happened in care homes, they need the truth, unvarnished.